Breastfed Beginnings at UF Health presents Prenatal Breastfeeding Education, Module 1. This presentation is part of a series on the benefits and practice of breastfeeding. Breast milk is more than food. It is the perfect meal for your baby for the first months of life, and the act of breastfeeding helps you develop a special bond. This lesson will focus on the benefits of breastfeeding and the importance of exclusively breastfeeding for the first 6 months. Breastfeeding offers an opportunity to get close to your baby while you feed and develop a special and protective bond. But what's so special about the milk? Both breast milk and formula contain similar amounts of water, protein, carbohydrates, fats, vitamins, and minerals. However, breast milk contains proteins, carbohydrates, and fats that are specific to the needs of human babies. Artificial baby milk, on the other hand, contains cow's milk or soy protein, table sugar or corn syrup, and fats. In addition, breast milk provides lots of other important nutrients that protect your baby by sharing your immune system, enzymes, and hormones. Another advantage is that breast milk changes during the first few days of feeding to meet your baby's changing needs. Because it is made just for them, breast milk is easier for infants to digest than artificial baby milk. And don't forget about the cost saving and convenience of using your own milk instead of buying formula. Like many leading health organizations, we recommend that most infants breastfeed for at least 12 months, with exclusive breastfeeding for the first 6 months. This means that babies are not given any foods or liquids other than breast milk for the first 6 months. These recommendations are supported by organizations including the American Academy of Pediatrics, American Academy of Family Physicians, American Congress of Obstetricians and Gynecologists, American College of Nurse Midwives, American Dietetic Association, and American Public Health Association. Why only breast milk? There are benefits to both you and your infant that are most significant in infants and mothers who breastfeed exclusively for 6 months or more. Now let's talk about specific benefits of breastfeeding. There are many benefits of breastfeeding for your baby. Studies show that breastfed infants get fewer ear infections and fewer lung infections. They also experience allergies and asthma less often, less infectious diarrhea, and are less likely to develop diabetes or cancer as they get older. It is important to note that infants who are breastfed exclusively for less than 6 months or who are partially breastfed have an increased risk of pneumonia and recurrent ear infections compared to those who are breastfed exclusively for the first 6 months of life. Breastfeeding doesn't just have health benefits for the baby. Breastfeeding has been shown to lower your own risk of ovarian and breast cancer and get you back to your pre-pregnancy weight sooner. So again, it is recommended by pediatricians and health organizations all over the world that you exclusively breastfeed for the first 6 months of life and continue to breastfeed beyond 6 months with the addition of solid foods. Planning for labor before the big day will help you get breastfeeding off to a great start. Talk to your partner and your doctors about what you want before you are in labor so you have time to get all the information and make good, thoughtful decisions. The staff at UF Health is prepared and eager to help you accomplish your goals, including placing your baby immediately skin to skin and starting the first feed within the first hour of life. You should also talk to your doctor about pain medication while you are in labor. If you choose to have pain medication, it's very important to start your first feeding immediately after delivery, when your baby is most active and alert. All babies will have a sleepy phase 1 to 2 hours after delivery, and this sleepiness might be increased if you use pain medication during labor. Some babies might have a decreased suck reflex and have a hard time showing you feeding cues. Be patient with your baby and keep trying. Keep baby skin to skin, and baby will let you know when he or she is ready to eat. If you choose to labor without medication, there are other ways to help you manage your pain. Some women like to spend the early stages of labor at home before coming to the hospital. Regardless of where you are, try moving around so that you can find a position that's comfortable for you. Taking a childbirth class with your partner will help prepare for the big day. It is important to remember to breathe and relax during labor. Make sure your partner knows that you will need a calm, quiet environment with limited visitors while you await your new arrival. Make a plan ahead of time that seems best suited for your needs. Childbirth classes prepare you and your support person for labor and birth. Prenatal breastfeeding classes will also help you prepare for your new baby. Here are some options for prenatal breastfeeding classes. You can find more information online using the links shown here, which we will provide for you on a handout to take home. Thank you for joining us for this discussion on the benefits of breastfeeding. If you have any questions about what you have heard, please ask your doctor or nurse, and we will be happy to provide you with more information.